Hello, everybody. Senior engineer, MBA, and investor. And in today's second take of this video, because I forgot to record the last one in today's morning on the Saturday, I just forgot to click this recording button. I want to talk about this interview clip between Dr. Liu and the Summit 2022, where they talked about the FDA, they talked about CRISPR. And I think there's a really good clip here posted by Yer on Twitter a couple of days ago. Again, shout out to Yer for doing amazing work in the CRISPR/genomics landscape. Always learning, always publishing great information. So thank you so much, Yer. So if I go ahead here and I play this clip and let's try to decode what Dr. Liu is saying, which obviously everybody knows Dr. Liu at this point, founder and related to Prime Medicine, Beam Therapeutics, doing amazing work in the CRISPR landscape with a lot of work in the lab space, which recently I think he published, him and his team published a great paper recently on deliveries. But anyways, let's go ahead and play this video.
CRISPR has, and gene editing in general, has really, I think it's safe to say, revolutionized the life sciences. I realize it's an overused phrase, but virtually every lab who works in the molecular life sciences with genetics uses CRISPR as a tool. So in some ways, CRISPR has already democratized gene editing for research. For therapeutics, questions of equitable access and how to ensure that the medicines that are being developed can reach the broadest possible range of patients is, a major aspiration that we all have to work on. We all meaning scientists, doctors, regulators, companies that are involved in selling and marketing these drugs. And there's no simple answer for how to do that. But I think being able to treat the broadest possible range of patients through regulatory mechanisms that still ensure safety and efficacy, but for example, don't require companies that are developing gene editing drugs to start from step one if all they've done is changed the guide RNA for an FDA-approved drug to move it from targeting one location in a target gene to targeting a location that is in the same gene but different. That will go a long way. Streamlining that regulatory process will go a long way to maximizing access because it will maximize the number of different patient cohorts with different mutations that can benefit from gene editing therapeutics.
So I actually really much agree with Dr. Liu in his last part where he mentions that, I think the FDA shouldn't look at it from scratch, like from step zero for all these CRISPR companies entering in the landscape and trying to get their programs FDA approved, going through IND submissions, phase 1, phase 2, phase 3. I think there should always be a phase 1, phase 2, and phase 3 process, but the FDA should probably look at what was already approved in the past, what was already done, proven that it works in humans, human therapeutics anyways, that it's completely safe, and then start from scratch there as opposed to starting from scratch literally from zero, right? Because that's going to reduce delays, significant delays. So, which is of course a plus in the innovation space, right? It's all about promoting innovation. It's all about accelerating the pace of innovation, right? Whether that's CRISPR, whether that's social media, whether that's fintech, whether that's electrical vehicles. It's always about how do we accelerate innovation while keeping safety at the top of the priority for citizens around the world, right? And I think we all agree that in the human therapeutic side of things, whether that's CRISPR, whether that's any other tool in genomic side of things, safety is going to be literally the first topic that is brought up on every step of the way, right? So that's a good point. I will also say that at the beginning, Dr. Liu said that it's an overused term, the revolutionizing the life sciences. I don't agree with that. I think it is actually the term to use. It is revolutionizing the life sciences. It is being adopted in labs, like Dr. Liu said. So obviously, the cat is out of the bag, right? The tool is out. People are using it. And of course, there's companies are obviously trying to get their programs commercialized. I think one stakeholder that Dr. Liu forgot to talk about is investors. I think he mentioned companies, he mentioned regulators, He mentioned scientists, but he did not mention investors. And of course, I think he's just bundling companies with investors. But the reality of the thing is, investors are not bundled in companies. They're companies, then they're investors, investors such as myself, such as you guys watching this video. So investors are really important in this story. I think we have to be patient. We have to let the story play out. We have to let the FDA know about what is the truth and what is the non-truth, right? What is the distruth or whatever you want to, dishonesty, whatever. You have to distinguish that with your local politician. If you're in US and if you're in Canada, you have your MPs there. So, or if you're in Europe, obviously you have your regulators, right? I don't know how to pronounce this word this morning. It is Saturday morning, guys. Wanted to pump this video out because my brother's coming here in town. He's going to see me just shortly, so I want to pump this video. But hopefully I'll see you guys in tomorrow's Sunday's video. And wherever you are, hopefully it's better than here. It's snowy, it's cold. But that's the life in Canada, right? On winter, brutal winter. Do like this video if you haven't liked it. Subscribe if you're not, and I'll see you guys in tomorrow's Sunday video. Thank you, guys.
That are being developed can reach the broadest possible range of patients is,